what if you've been spending way too much time exercising and getting less out of it than you think? Most people believe more is always better when it comes to working out. More hours, more intensity, more sweat, more results. But that's not what the science shows. There's a concept in medicine and pharmacology called the minimum effective dose. It's the smallest amount of something needed to produce the desired result. Go below it, nothing happens. Go above it, you get diminishing returns. Sometimes you even cause harm, and it applies to exercise more than almost anything else. Here's what the research actually tells us. A landmark study published in the British Journal of Sports Medicine found that just 11 minutes of moderate intensity exercise per day was associated with significantly lower risk of heart disease, stroke, and certain cancers. 11 minutes, not an hour, not 90 minutes, 11. Another major analysis found that the biggest leap in health outcomes happens when you go from doing zero exercise to doing just a small amount. The difference between zero and something is enormous. The difference between a lot and more is surprisingly small. So, what does the minimum effective dose actually look like in practice? For cardiovascular health, current evidence suggests around 150 minutes of moderate activity per week. That breaks down to about 22 minutes per day. A brisk walk counts. Cycling counts. Swimming counts. It doesn't have to be structured gym time. For strength and muscle preservation, which becomes increasingly critical after the age of 30, 2 resistance training sessions per week appears to be sufficient to maintain and build meaningful muscle mass. 2 sessions, not 5, not every day. Now, here's the deeper insight most people miss. The body doesn't get stronger during exercise. It gets stronger during recovery. Exercise is the stimulus. Rest is where the adaptation actually happens. When you train too much without adequate recovery, cortisol stays elevated. Muscle repair is incomplete. Sleep quality drops, motivation fades, and your body starts breaking down faster than it can rebuild. This is called overtraining, and it's far more common than most people realize, especially among people who are highly motivated and push themselves hard every day. More is not always more. Strategic is always better than excessive. There's also the consistency factor. Someone who exercises moderately 4 days a week for 2 years will almost always outperform someone who trains intensely for 3 months and then burns out completely. Frequency and sustainability beat intensity and exhaustion every single time. So what does this mean for you practically? If you currently do nothing, start with a 15 to 20-minute walk each day. That single change, done consistently, has measurable effects on cardiovascular health, mood, blood sugar regulation, and longevity. If you already train, consider whether more sessions are actually adding value, or whether they're just adding fatigue. Sometimes removing a workout and replacing it with genuine rest produces better results than adding another session. Your body doesn't need to be punished to change. It needs to be challenged and then given the time to respond. The goal isn't to do as much as possible. The goal is to do exactly enough, consistently, for the rest of your life.